Diabetes is a chronic illness that requires daily self-care. The stress of diabetes management can take a toll, which can lead to feelings of helplessness and sadness. These feelings can prevent you from taking care of yourself. Depression can be caused by a chemical imbalance in the brain. Anyone can become depressed, but people with diabetes have a higher risk of depression than people without the disease. Like diabetes, depression is a serious medical illness. It can affect your life. Symptoms of depression may keep you from maintaining good diabetes control. Feeling down every so often is normal, but some people feel sadness that won't go away. Feeling hopeless or very sad for 2 weeks or longer is a sign of depression. Symptoms of depression include feeling sad, empty, or lonely, loss of interest or pleasure in activities you used to enjoy, unplanned weight loss or loss of appetite, sleeping too much or too little, difficulty concentrating, fatigue, feelings of worthlessness or guilt, or reoccurring thoughts of suicide. If you experience 2 or more of these symptoms most of the day for 2 weeks or longer, it's time to get help. If you're having suicidal thoughts, call 911 or a crisis hotline or go to the emergency room. Thinking seriously about suicide is an emergency. You need to get help immediately. For people who are depressed, getting help can be difficult, but it's the first step towards getting better. If you think you may be depressed, talk to your doctor about your symptoms. If your doctor isn't familiar with treating depression, ask for help finding a specialist who is. Besides working with a professional, you can feel better by making healthy lifestyle choices and surrounding yourself with others. Some self-care strategies include talking about your feelings, eating healthy meals, getting plenty of sleep, staying away from alcohol and drugs. These can make depression worse. Exercising by walking, playing a sport, or something else you enjoy. Volunteering, joining a club or taking a class. Spending time with loved ones, or trying to do the things you enjoyed before the depression. As with other illnesses, it can take time to get better from depression, but you don't have to do it alone. There are local resources in Durham to help you. You can call Alliance Behavioral Healthcare at 800-510-9132 for help figuring out what to do next. You can also walk into their Crisis and Assessment Center located at 309 Crutchfield Street. More information about Alliance Behavioral Healthcare can be found at alliancebhc.org. The National Alliance on Mental Illness Durham chapter offers support and education for families and those with mental illness. For more information on National Alliance on Mental Illness services, call 919-321-5016 locally or 800-451-9682 toll-free. You can also visit NAMI Depression is an illness that can be caused by many factors and can make it hard to maintain control of your diabetes. The most important things to do are to get help, take care of yourself, and get on the path to healing.